Okay, Nurse Key here, and welcome back to the New Nurse Bootcamp. So, this is episode 3. After you got report, what's next? So, we talked about giving report at the bedside, right? And this is generally between nurse and nurse. Now, let's include the patient. So, I like to do what is like a mini assessment just so I have a baseline before I get like the full information from the patient chart and then do my full head to toe. So, my mini assessment would be going up to the patient, introducing myself. I can get a gauge of their mentation. Are they able to wake up by just voice, or are they already awake or alert? Do they only awake to touch, or are they only stimulated with pain, whether it's a sternal rub or a pinch? How much level of interaction does it take for your patient to be engaged and maintain a level of alertness to actually function? So then also you get to ask your questions of like, okay, can you tell me your name? Do you know where you are? What's your date of birth? What year are we in? Just to see what their gauge is of their memory as well. That also, this level of interaction tells you, can they hear, can they see, do they appropriately turn their head to which side that you may be standing by? Are they able to properly answer the questions, or are they properly able to follow the commands that you're asking them to do? Again, we talked about the breathing, bleeding, and the bowels. We're going to check their skin for any urgent things that we may need to attend to. And then the respirations, right? The breathing. Do they look like they're having shortness of breath or signs of distress? Is it labored breathing? Is it unsymmetrical breathing? Any bleeding? And then bowels, are they soiled? All right, so if my patient is not in urgent need of care at this moment, I'm going to take my handoff report. I'm going to go to the patient chart, and now I'm going to not only verify what I was given in report, but I'm now going to fill out the full patient information and kind of gather what I'm going to be doing with this patient today. Whether that's medications, any new orders, whether it's labs, diagnostic tests that may need to be happening, their treatments, physical therapy, occupational therapy, or just everything in between. Wound care. I'm going to try to get as much information so we can plan accordingly, and also so I can let the patient in on what our plan of care is for the day and write it on the whiteboard, so everybody's on one accord. Um, so you have to make sure that you understand that handoff is kind of like a skim of the person. They're going to give you the most vital things that are needed to kind of like change hands of that patient, but it is your due diligence to verify and validate the information given and know your patient in totality, because the patients will ask you, the physicians will ask you, the family will ask you, and so you're kind of like the best representative of that patient for the day.